Hello, everyone, and welcome to Food Access Data as a Public Utility. I'm Natasha Pernica with the Food Pantries for the Capital District, and I'm here with Dr. Jacob Ryder from Alliance for Better Health and Donna Canestraro, who's a consultant who does amazing work for us. And we're going to talk about food access data as a public utility, and what does that mean? I'm still learning about it, and it's a really engaging conversation I'm enjoying. I want to start by giving you all a little bit of an overview about food access data and what the Food Pantries for the Capital District is doing and how we got here. And then we'll kick it over to Donna to do a demonstration and then go to Jacob from there. So the Food Pantries for the Capital District is a coalition of more than 65 food pantries in a 4-county region. And years ago, when we looked at the food insecurity numbers in our region, there were more than 80,000 people considered food insecure. And there were about 50 to 60,000 people who were utilizing food pantries as a resource. And so we were concerned about the gap. We wanted to understand, why is there a gap? What access and stigma issues are there? We want to take a look at the resources. Do we have appropriate resources to meet community need? And so we did our Filling the Gap Food Pantry System and Community Needs Assessment. And one of the things that came out of that was our hunger heat map. So as an organization, we created a hunger heat map showing throughout our district where there were the numbers of people at 185% of the poverty line, number of households. And we did an overlay with the service levels at food pantries where we could really see where are the biggest gaps between access to pantries and potential food insecurity. So with our hunger heat map, we also had an asset map, which showed the community resources like food pantries and other community meal programs. And we made this map public so that anyone in the community could take a look and find the pantry that's closest to them in their neighborhood. And it also could also use it for research and other projects to look at some of the stats in our area. So we started with our hunger heat map and food access map, and we had this data for the food access or food providers, basically food pantries and soup kitchens and community meal programs. And we thought, we've got a really great list here. How do we share this list with other organizations like 211? And there's the Food for New York app that was being developed. And we worked with United Way, and we talked to Alliance for Better Health and said, hey, we think that only it would make sense for one organization to be the source of truth for this data and make sure it's kept up to date. Instead of every organization keeping the same data, the Food Pantries for the Capital District keeps the data up to date, and then we share it through an API that was funded by Alliance for Better Health to other organizations so that we all have consistent, up-to-date information about the food access data that we have. So that's kind of how we started this project. During COVID, we had several state agencies reach out to us to say, Natasha, are there any statewide resources? And at that time, there wasn't one place that you could go to get a listing or map of all of the food pantries and community meal programs across the state. And since we already had the map and the database, we said, well, we can just add it and upload it into the system and then continue to share it out from there, which was a really amazing collaboration with Susan Zimmett, the Hunger and Food Policy Coordinator for New York State, and Department of Health, New York State Department of Health, in which we now get statewide data that feeds into our map as well to 211 and other organizations. So that's the quick overview. And I'd like to invite Donna Canestraro to do a demonstration of where we're at with that project right now. Donna?
Wonderful. Thank you, Natasha. And thank you all for attending our session. What I'd like to do is have our map come up on your screen so that you can get a sense of what it looks like. And what I'd like to walk you through is how this map actually works. You'll notice that the map has all these little red icons, but it has this blue icon which shows where I am currently located. which is at 32 Essex Street in Albany, the home of the food pantries for the Capital District. So the minute you go to the map, it will relocate you based on your laptops or PC's GPS location and bring you and show you where you are located. On the left-hand side, it shows you a variety of different categories that you can actually look for on the map. Right now, I have food pantries clicked, so it shows me all the food pantries across New York State. But we also have other categories that are historically categories that we track within the food pantries for the Capital District: children and youth programs, community meals, soup kitchens, holiday meals, housing, medical assistance, even pet food pantries. During the coronavirus or the COVID outbreak, we started to track that as well. Senior center meal services, senior services. And down here is the heat map that Natasha talked about. But if one is looking for food pantries, it defaults at food pantries so that when you come to the map, it shows you a listing of all the various counties. And if you wanted to look specifically for a food pantry within your county, you could click on the county and it drops down an alphabetical list of all the food pantries that we carry, we have information on within the Capital Region. At any one of these, we would be able to click on the food pantry. It brings up a little blue icon here, and it brings up information about this food pantry. It gives you an address. It gives you general information, especially during COVID-19. This was constantly being updated because hours were constantly changing, information was changing. It allows you to click to the map or to the website for this food pantry itself. It tells you when it was last updated, and it provides you with a phone number. If you really want to see exactly where it is within Albany or within New York State, you can zoom to that location and it brings you directly to where that food pantry is. What's nice about this is that it also gives you landmark street addresses, so that if you are within, this is the pantry that you want to, say you're on 6th Avenue and you wanted to be able to get to that food pantry, you would actually know how to transverse and go to this food pantry. We also have a little help to screen here that says how to use the map. So if it's your first time using the map, we have this pop-up screen that kind of walks you through what are all the different various parts of the map, and then how do you navigate it? How do you search using the search bar? How do you handle the left side menu? And then also, how do you zoom in on the map? So it's just a quick guide to help you be able to understand. You also have the capability in this upper right-hand search box to be able to put in a specific address if you're looking for a specific address. Say that I was looking for 40 North Pearl. I know I am here in Albany at 40 North Pearl Street, and I want to be able to see what food pantries are close by 40 North Pearl. It zeroes me into that area. Again, you can see landmarks and some foods, restaurants that are nearby, but you'll notice these two red icons. If I click on this one, it brings me up and tells me exactly what food pantry it is. Again, it gives me general information and hours of operation. It allows me to go to their map or to be able to call if I wanted to double check their hours. This is the other pantry that's within my area. It may be closer to where I'm actually located. Say I'm staying at the in the Chapel Street area. It again gives me information. You're able to use this search bar to be able to type in any address or area or the name of an actual food pantry. Now, one of the things that we're going to ask you later on in the discussion is, let me come back to, is how would you use this map? How do you think it should be improved? We are actually going through and soliciting information because we're going to create an advanced search functionality. Besides that simple search bar, we want to be able to have people be able to look for, say, my location is 123 Market Street, and I'm looking for a food pantry within my vicinity, within a 15-minute walking distance, or I'm looking for a food pantry in the city of Troy. Now, one of the things that Natasha mentioned is through the generosity and the help of Susan Zimmett and her contacts with Department of Health, we were able to acquire our HIPNAP data. And having the HIPNAP data has given us the ability to broaden our map to be all of New York State. The challenge that we have is the HIPNAP data is not refreshed as quickly or as frequently as what our capital region data is. So we're looking for coalition partners who may actually have their data, such as Rockland County has a hunger coalition that they share their data with us, and they upload it to our system where we're then able to display relevant current information that they maintain and update on their own through the back office area of this application. We also have the ability, as Natasha said, to share our data with anyone who needs it. You can either put the URL on your website and be able to then have your website have a vision or a view of our map and have full functionality, or you can use the data in other ways where we have what's called an API, an application programming interface, that allows you to extract the data from our database and ingest it into your own system, like New York Connects, Department of Social, New York State Office for the Aging actually takes our data on a monthly basis and uploads it to their New York Connect website, so that they are constantly refreshing their website with updates of, at the point with COVID, it was closures, now it's openings and new information. There's also a mobile app called Food for New York that works on Android and Apple phones, that actually, again, uses our data, exports our data to their mobile application, and it allows people to use their actual phones to be able to look for food resources and a variety of other resources on their phone. Our map does render on a phone, but it was not designed to be on a for a phone application, but it does render on a phone if you do need to use it from that standpoint. But Food for New York has a different mission. They are looking at resources broader than just food access. So they have an agreement with us to acquire our data. And we're willing to share our data freely with anyone who is interested in using our data to help support the work within their own areas. If there's any questions, please feel free to type in the comment area, and I'd be happy to answer them as we move on with our program. I thank you for the opportunity to show you the map, and if at any point you would like more information, again, reach out to either Natasha or myself, and we'd be happy to set up a time where we can go into more detail. But we are looking for coalition partners to help feed information into our map, and then also partners who would like to export data from our map, knowing that we are the source of truth for this information. So Natasha, thank you for the opportunity to show this, and it's been an exciting project that we've been working on, and it really came to fruition with the pandemic, because it was allowing us to be able to be positioned in such a way to be able to help others in the community find food. So thank you very much.
Great. Thanks, Donna. I hope you all were able to kind of get a sense of the map and how it works. And so we want to shift gears a little bit and just talk about the concept of data as a public utility, and what does that mean, and the future of data sharing. So Dr. Ryder, I'm going to kick it over to you.
Thanks, Natasha. It's a tall order to talk about, the value of data, and yet I think we all appreciate that data is very useful, and in fact, we are all both victims and benefactors of data utilization. The batteries in my garage door keypad were low yesterday, and Alexa reminded me yesterday morning that the batteries were low, and if I wanted to say, oh my God, it just said something to me. See, there's data for you. So the thing that starts with an A that I will not say again, offer to to order me batteries because the batteries were low. So that is an example of how data can be leveraged. Now, in this context, it's leveraged for commercial purposes. The question that Natasha asked me is, how can data be used as a public utility? And I want to rewind a little bit and think out loud about what is a public utility and why is it that we would consider data to be used as a public utility. So for those who don't know, Alliance for Better Health is an organization that primarily is working in the capital region. We're starting to work in some other regions as well. And we bring together organizations that we call social care providers, sometimes referred to as community-based organizations. Part of why we don't say CBO or community-based organization is we also include medical providers or behavioral health providers, so long as they're providing services that address social needs. So obviously, food insecurity is a social need. The goal of our organization is to bring these organizations together so that we can collaborate toward improving the health of the people that we serve. And if you address social needs, and we all now are familiar with the term social determinants of health, if we address social needs, then people don't, the word we use is fall down the cascade of social needs becoming medical needs, right? And so as Natasha mentioned at the beginning, I'm a family doctor. We very much want to prevent medical problems. We don't want to react to medical problems. And yet, over the past, 7 or 8 decades, most of the way that people like me have been trained is to react to medical problems. So what's been really exciting is that we can now shift our view upstream and say, well, wait a minute, why would we wait for these problems to become medical problems? Let's prevent them from becoming medical. So if we can address food problems or housing problems or transportation problems early, then they don't become medical problems. And so back to Natasha's question, if we view these things as a public utility, then we all can, as you heard from Donna's description, contribute to, but also receive from this asset that is shared across a community. And so if we think about other things that are public utilities, say, for example, if anybody's looking out the window, I encourage you to do so, both so you don't stare at me the whole time and so that you appreciate how big the world is. If you see something that cars are driving on, sometimes referred to as streets, that is, for the most part, a public utility, although there are some private ones, as we know. Say street lights or telephones, or in some cases, internet service providers are to some degree public utilities. And so these things are shared, and most organizations don't compete on the basis of these assets. So for example, we don't have 2 health systems that might populate the same region compete on whose streets they are using, right? They agree not to compete on that. They both pay their taxes, the streets are available, and they're shared. And so in the same way, as we saw Donna's demonstration, this is a shared asset. It's not owned by Northwell or New York Presbyterian or Albany Medical Center or Capital District Physicians Health Plan or Humana, right? It's not owned by any organization. It's a shared asset that we all can contribute to. And then on the basis of our shared contributions, it's also more valuable for all of us. And so this is the concept of a public utility. And this is why, in general, our organization, Alliance for Better Health, has supported this initiative and has been thrilled to see it sort of grow from gestation to maybe early adulthood, and really excited to see it grow from here. So I'm going to hand the talking stick back to you, Natasha, for the next iteration of our discussion.
Great. Thanks, Jacob. So that's, relating data to the concept of public utility that is a shared resource for everyone in the community to benefit from. Wanted to kind of have a little bit of a discussion about why is this important for food access resource information? and how we can use this resource in a better way for everyone. And when we think about the stakeholders for food access resource information, I mean, you can talk generally about the entire community, but really, there are a lot of different stakeholders. One group would be people who are seeking food assistance. Another group of stakeholders would be caseworkers or people trying to connect people needing food assistance to the resource, as well as all of the organizations who provide the food resources. Those are just some of the stakeholders. So when we think about this future of data sharing, wanted to get some interaction with those of you in this as participants, but wanted to also see if Jacob or Donna have any initial thoughts on why sharing food access resource information is important to different stakeholders and being a public utility.
Well, I'd be happy to start. During the pandemic, prior to us, we had already released the map, already had test drived it for the capital district regions. It became very apparent during the pandemic of people being able to find access to food within their area and being able to locate it in a very easy manner without having to jump through a lot of hoops of making phone calls and trying to find people who were knowledgeable about it. So by searching for food assistance, they were able to easily come to our website to be able to look to see what food pantries were open, because many of them had to close due to volunteers, lack of volunteers due to the COVID pandemic, or lack of food resources, that they were very small operations. So how do you find a food pantry that is open? And through the reference desk at the food pantries for the Capital District, our people were able to point consumers to the website to be able to search on their own, but also to be able to provide them quick access. And we kept the website updated on a daily basis, keeping track of the changes with the timeframes of when food pantries were open, who were closed, it was a constant moving target. And it was so important to get this information out. So it became very apparent the need for this type of research and how important it was to be able to widen it to the whole state. So I think that was a good example of why this data sharing and being able to know that the data is accurate was so important.
Thanks,
Jacob?
Donna. Thanks. Yeah. And Jacob, do you have any thoughts?
Predictably, yes. I think, as Donna expressed quite well, and so I'll try and make this one short. The whole purpose here is to make the right thing to do, the easy thing to do, right? This is what information technology empowers. And so depending on, who we're talking about, which stakeholder, is it the case manager at the health plan? Is it a care coordinator in a health system or a medical office? Is it an individual? Is it a friend or relative who just wants to help? So if we can make the right thing to do the easy thing to do, then together we're successful. If, as Donna described, there are too many hoops to jump through, or there's too much hassle, or the way the software engineers think of this, too many clicks, at some point we quit, we stop trying. And so if it's easy, it happens. If it's not easy, we hit emotional and technical barriers, and then we can't achieve our goal.
Yeah, that's great. Thank you. And I wanted to add a little bit about, the importance of food access resources being considered more of a public utility as opposed to like a marketing tool or something to generate revenue from, because in the nonprofit sector, we're used to not trying to develop programs or projects that develop revenue. That's not really our goal as a business model. Our goal is to create something that helps the community in some way. However, a lot of us organizations end up competing because there's only so much grant funding for certain services. And so we want to do it well. And sometimes projects can become a marketing tool. And I think it's really important for the access to the food access resource information to not be a marketing tool that drives people to any one particular website. I think it's really important that the bigger mission of having this information be accessible to anyone who needs to have the data is more important than the potential for this being a marketing tool to drive website traffic. And so I think that's why I love introducing this concept as the public utility, because the way we're handling the project is that we're willing to share the data or map to anyone who's using this really for the greater good, so to speak. We just want to make sure that the data is out there for people to access, which is the whole point of why we're doing this. But on the other side, we need to make sure that in able to do it well, you have to have the funding to support it, which takes people to update the information and the technology infrastructure. So that's how we move forward in building projects like this. So I wanted to switch gears a little bit to open it up to the audience. And I do see that Daniel Budd has mentioned that they have an intern on a project to public their own analytics. So he's looking to chat with people who can offer advice on systems to use, which is great because right now you're working on, you have tons of data in Google Sheets and communication and dispatch system. And I think we'd love to reach out to you, offline. And it looks like John Roda is also willing to talk, which is great because I think a lot of organizations struggle. We've got great data, but how do we use it effectively and efficiently? So thanks, Daniel, and thanks, John, for jumping in there on that. I want to shift gears to some of our questions that we'd like to ask as far as food access resource data. For those of you who are participating, how would you use this data? How would you use it? And what is the most important thing to consider for your use of the data? And I'd love to hear from you, Daniel, John, whoever else is as a participant. How do you think this data is useful? And what would be most important for your use? And I see lots of measuring. So I wish we could have it more interactive so we could actually talk with you, but I'm watching you in the chat. What kinds of things are you looking at measuring, Daniel? If you could put that in the chat for us, would love to know what you're looking to get at from measuring the need and financial forecasting, right? I think measuring need and financial forecasting is critical for any business, right? Forecasting and need. And I think it's incredibly challenging for the nonprofit sector because a lot of times we don't have the data in one place as a community or as a geographic region. So each nonprofit is operating in a silo, and it's hard to make business decisions on programming and how much money do you need to write a grant for, how many people do you need to hire in order to get the work done. And I see, Daniel, you're saying also setting goals for solutions, which is right. How can you come up with solutions that are tangible if you don't have the correct data to work with? So that's great. Thanks, Daniel. And then I see Kayla here is looking to target underserved folks. So Kayla, so are you saying this data would help you to target underserved folks? If you want to put a little bit more about that in the chat, that would be great. John Roda is saying a quick inventory of related public data sources yielded over 50. Can you go into that a little bit more, John, about public data sources of what in particular? Food access data?
For those who don't know, John is a data geek. And so I suspect he has done some research of some public data sources, and he's reminding us there that there are lots of public data sources. Albany County has public data sources. The state has public data sources. I suspect that's where John is going. Oh.
Yeah, can you speak a little bit more to the public data sources, Jacob, that John's referring to?
So there's lots of data that is publicly available. And I'm tempted to go online and show you, but I'm going to resist that temptation at the moment. population data by breaking up by zip code about demographics. There is socially determinants of health data. There are data about economic variables, so we know we can figure out where are the wealthy people and where are the not so wealthy people. So I think these are the things that John is describing, and if we put them all together, we can develop extraordinary insights into the needs of our communities. And I think what's great about this initiative is that this is a data set, and I think Donna has described really well the fact that it's really tightly managed, and curation of data is, I would offer, the hardest part. And as Donna described earlier, the statewide data is not as well curated as the data that Capital District Food Pantries has maintained. And I think this is the biggest challenge with all the data sources that John is describing. Some are updated quite a bit. Some are describing not so much. And I'll read what John wrote. What I meant was data sources that are available through government and other public sources, examples SNAP in counties in New York City, combined with SNAP participation rates. So all of these are available, and yet I think the SNAP data is certainly not updated on a monthly basis. We don't even know, how many Medicaid recipients are in a given county for probably 12 to 18 months until after that data is valid. And so I think the key here is, as granular as data as we can get, and as frequently updated data as we can get, this is what makes it truly useful. Because as the pandemic taught us, the needs change rapidly and the availability of resources change rapidly. So we need to have very tight insight into what's happening, what the needs are in the community, and that will then justify, and I think this speaks to one of your questions earlier, Natasha, then we can justify resource allocation, not justify as in defense, it's offense, right? This is, how do we proactively engage both government and philanthropy so that we can address the needs before they become too great? And in order to do that, we need to have rapid access to fluid data sources.
And if I could add something, Natasha, Jacob, that was a wonderful explanation. And I think we need to talk a little bit about what secondary use data is. So the data that we do get from Department of Health is specific to their hunger prevention program. That data is collected on a yearly basis or every 2-year basis, but during COVID, it was updated more frequently. But that data is created and updated to Department of Health for a specific reason. Now, we as the coalition and the food pantries are taking that data and using it for a secondary purpose. And our secondary purpose is looking at the pantries and what their current situation is. So while it is meeting some of our needs, it's not meeting all of our needs, except for the data that we collect within the Capital Region and Rockland County, because we are collecting that data specifically from the data source. So there are many data sets that are out there. If you go to data.gov or New York data sites, we have a slew of data resources that are out there, but you have to think about what that data was collected for, what the questions are that you're going to ask that data of, and does it actually meet your needs? Are you going to have to manipulate it in some way in order to get it to the point where you can actually answer the questions that you want to answer? So it is excellent that there are a lot of data sources available to us, but just looking at the data sources alone, you may not be able to answer the questions that you have. And so that is why when this map was created, it was for a very specific purpose. And we're trying to use some of the data that's available, but now we're looking for, as we have received from Rockland County, their data specific to this need. And it just means that the data is a lot cleaner and curated, as Jacob mentioned, to be able to answer the questions that we do have. So it's a complicated problem, but it's not a unmanageable problem.
Yeah, and go ahead. Did you want to add to
Well,
that, Jacob?
I'm just gonna make it simpler than complicated, and I'm gonna revert to my see if I
I think you have
this
to
thing
put it
doesn't
right
work.
in front of. Oh.
No, but Oh, there
There
we
we
go.
go.
Almost.
There you go.
Here. Okay. So the 4A's. See the 4A's? And
Yes.
now you've got it in your brain, so you don't have to look, and then you don't have to see my non-backgroundy background. So the 4A's are how we move data to information so that we understand the data that we have. So the first A is acquire, and this is what we've been talking about today. The second A is aggregate. We pull it together and make some sense. How do we make some sense? Well, we analyze. So that's the third A. And then the fourth A is act. What do we do with that understanding? And so when after we analyze, we turn data into information, and information causes action. As John mentioned in the chat, action could be at the very micro level, which means an individual does something for themselves or for another individual, or a broad macro level where we might make a new policy, or we might make a new regulation or a new law that defines a priority for a community as small as a neighborhood or as big as the whole world, right? So this is how I simplify what Donna described as complex, because I am a lumper, not a splitter. It's all about the 4A's, and that makes it easy, at least for my little brain.
Thanks, Jacob. And I see Molly Nickel asks, do you use Feeding America food insecurity data? And I think that Feeding America food insecurity data is helpful when you break it down by a county. When we put together our hunger heat map, we needed to break it down. We needed to drill down even further to a neighborhood level when we did our gap analysis, and the Feeding America data didn't allow us to do that. And so we actually use census data at 185% of poverty line, and then at poverty line, so that we could do the gap analysis between the service levels of the pantries and potential. We use that for potential need. It's not, completely 100% accurate, but we thought that was a good measure to use. Oh, you can break it down by zip code. I didn't realize that. So that's a great tool. I don't know. We created that, I don't know how many years ago. So it'd be nice to revisit that and potentially even overlay that in the hunger heat map. Will be something we'd have to explore. Thanks, Molly. Appreciate you mentioning that. So when we look at maps, the Feeding America Food Insecurity Map is a great resource for anyone across America to take a look at the food insecurity stats. As far as the food access, Food Connect map that the food pantries has, how would you use the map? And what do you think is the most important thing for your use of a map that has food provider, food access data on it? If you can put that in the chat, we would love to get your thoughts on how would you use a map and what would be most important to you for use in a map. And while I'm giving you a chance to think about how you would use the map and what would be most important to you, I see there's a question from David Cholker. Jacob, can you give some background on Healthy Together? How is it funded? How it fits into the landscape of referral tools like Unite Us? And also the public utility concept, asking because CBOs working within the medical structure are always trying to leverage these tools. So Jacob, if you want to jump in on that.
Okay, that's a 45-minute conversation, but I'll try and make it.
You have 5 minutes.
Oh, I'll do it in 3.
Okay.
I'll name that tune in 3 notes. So let's see, where do we start? Healthy Together is our brand of Unite Us. So Unite Us is the software tool that we use. It's one of several software tools that do this sort of thing. And through our partnership with Unite Us, we have created what we call Healthy Together, because we branded it locally. We just thought that was a better name for an initiative rather than naming the product. So that's how it fits in, is that it's our community. And gosh, I'd be lying if I told you I know the exact number, but it's somewhere on the order of 90 social care providers, medical providers, behavioral health providers in New York's capital region that are working together to use that tool. So how it fits together is that any organization that's using it can refer to any other organization that's using it, and they all make a commitment to respond promptly so that the needs of the individual that is seeking a service are met or not met rapidly. So if they're not met, let's say an organization can't provide that service, we know rapidly and we can find an alternative. So we found early in the game that some organizations didn't want to say no, but in fact, saying no rapidly is a much better service to the individual than just twiddling your thumbs. So how is it funded? Well, we are currently still running out the gas tank of DSRIP. So New York Delivery System Reform Incentive Payment Program, otherwise known as DSRIP. Alliance was a performing provider system and funded through the DSRIP program. We still have some gas left in the tank, and that is the funding that was created. And now we're evolving to a different business model wherein the services of the entities that we serve are aggregated, as we've described, I described earlier. And then, for lack of a better term, we're selling those services to health plans because we believe, and we think demonstrated that these services that are provided have return on investment. And if, using Natasha's term, marketed properly to the health plans understand and want to make investments in social determinants of health so that the medical costs are diminished. And so that's the very short version, I think I did it in 3 minutes, of what Alliance, what Healthy Together is, how it's funded, and how it connects to Healthy Together and other tools like it.
Great. Thanks, Jacob. That was amazing in 3 minutes. So kind of going back to some of the questions about how would you use the map, what would be most important? We have some thoughts here about using it to do gap analysis, using the map to research public access to food resources and look for problem areas, use the map to help folks learn what resources are closest to them, where they can find up-to-date information. So it's important that it's intuitive to a first-time user and with someone with low-tech savvy. I have to say that although I'm responsible for leading a lot of our tech initiatives here at the food pantries, I'm like one of the lowest common denominators. So we always test the technology out on me to see if I can use it here in the office. But yes, it's so important for things to be intuitive for people like me to use. And then having to balance, let's see what else, having to balance all the resource listed, but with potentially overwhelming someone, right, who can't easily determine what resources are near them. That's a good point from Catherine Miller. David is saying identifying resources for referrals not eligible for our services. Great. So I think, some of these are definitely for the actual, individual who's seeking assistance versus like a caseworker or someone who's trying to help someone use the service. So there's definitely two different stakeholder groups there that are going to have different levels of knowledge and understanding of eligibility requirements and transportation to get to the service, or is delivery available? There's a lot of factors that makes the data useful or not. And that's true when you're in a stressful situation and you're just needing help, it's a crisis, picking up the phone and making a phone call can be stressful if you're getting turned away and, it's hard asking for help in the first time. So whether you're doing it through technology and a map versus picking up a phone and making a phone call, we have to make sure that the data is useful in the various platforms and technology, from phone to internet to any other way that someone's going to need to access it. So we have about 5 more minutes. Wanted to see, we were kind of as we work on continuing to develop our Food Connect resource map and database. Again, we were asking, how would you use this data? What's most important, and how would you use the map? And what is most important for the use of the map? But also would love to hear other uses of data and questions that folks in the participants in the audience have. as well, because one of the things that we use data for that we haven't talked about really is telling the story. We're talking about how do we measure things, but really you get to a point, and we talked about earlier about how important advocacy is, and looking at policies. And if we want to end hunger in the big way of ending hunger, not I'm ending hunger for this family today by sending them home with a box of groceries, but if we want to truly end hunger, how do we use data to really share the story in a compelling way, to make action happen? And John, I see you saying also for grant writing, which is important. And grant writing is great so you can get resources and also educate the people who are in control of the funding, who might not be an expert in what it is you're trying to accomplish. So using the data to tell that story. Thanks, John. And Daniel says, I think we can leverage data towards educating the hungry towards feeding themselves easier and easier. And would that mean, Daniel, I'm making an assumption, do you mean that they would then have access to all of the different resources that are available? Or if you want to clarify that in the chat, that would be great. Wanted to bring it back to Jacob and Donna to see if you have any kind of closing thoughts or takeaways from today, or things that you'd like to share as we're getting near the end of our session today.
Very briefly, I'll offer that I think David brings up a really important point about how to identify resources for services for individuals that need services that aren't provided by organizations, or are provided by organizations that we know offhand, right? So many service provider organizations don't employ care coordinators or other people. So if you're a homeless shelter, you may not know all the food service providers in a region, nor are we expecting you to. So, one of the things that we do at Alliance is we have our referral center. So you don't need to know where to get the service. You just need to know that the service is needed. And I think it's back to right thing to do, the easy thing to do. So I think the data availability here is very helpful, so that no matter who is sort of trying to connect an individual to a service, there's an easy way to do that. And I guess I'll go back to the guiding principle: make the right thing to do, the easy thing to do.
Great. Thank you, Jacob. And Donna, do you have any closing thoughts, remarks?
No, I think this has been a wonderful session. And if others have thoughts about not only how you would use the map, but how would you search for data in the map, what would be the questions you would want to ask if you put it in the form of a question. We are actually trying to, as I said, enhance our advanced search function, and we would love to hear from you. So you can contact through Natasha or through other members of the Food Pantries for the Capital District to get messages directly to me. Because as we are starting to design the next phase of this map, I want to be able to ensure that it is not only intuitive, but also it provides the enhanced search capabilities so people can find the resources that they need. So thank you again for the opportunity to talk about this.
Great. Thank you so much, Donna. And thank you so much, Jacob, for spending your time with us today. I also want to thank all of the participants in the audience for being a part of this conversation. We hope that, the discussions continue and that you can make connections with people here today. This is an important part of the work that we do, and it's not always the most exciting part, maybe for the data geeks out there? Is that what you call it? It's exciting, but I think it's important for all of us to have a general understanding of how this plays into the greater work that we're doing. So I'll wrap up today's session with that. Thank you, everyone. We now have a half-hour lunch break. So the next session starts at 1 o'clock. Feel free to go to the Pulse and answer some of those polling questions that'll help us collect data about what you all think, so that we can use that to inform some of our advocacy and solutions working together with New York State CFAN. And I hope you get a chance to stretch your legs. We'll see you back in your next session at 1 o'clock. Thank you so much.
Bye, all.
Bye.